The process of having dental implants placed is dependent upon if a patient's missing a tooth. If the patient's already missing a tooth, then evaluation needs to be done, looking at the overall gum health, and also needs to be done to see do we have enough bone. It's about real estate. Just as you would build a home, you need a certain amount of land to build a home. And you need horizontal and you need vertical. And the same thing with dental implants. When teeth are often extracted, the horizontal component changes. And that diminishes the width of the bone that we have available for implants. And so, depending on the tooth, depending on the location, well, we may have to consider putting a narrower implant in that's designed to carry a heavier load, or we may have to consider doing a secondary procedure to grow the bone at the time of implant placement, and there'll be times that we actually have to do it in advance. But we have a number of different avenues and options available for patients to get their care as soon as possible.